Success as a therapist is not found in doing something for the client, but rather in being something for the client. A very good morning to one and all present here. Welcome to the 6th National and 1st International Conference of Holistic Therapies. I, Shivani, welcome you all this wonderful and informative morning. I also welcome esteemed guests and dignitaries. To bring awareness in reflexology field, ICR has started this week, in the last week of September since 1999. 5 years back in India, International Reflexology Jain Association has started a mission of mega event of free treatment. There are more than 1,000 therapists who are involved from all over the world in this mission. A few to mention: Indian Institute of Holistic Sciences, Aurangabad; Bharatiya Acupressure Yoga Parishad, Patna, Bihar; International Naturotherapy Organization in Delhi; International Sujok Association in Jaipur; Bihar Acupressure Yoga College in Patna; All Indian Association of Acupressure Reflexology, Delhi; Scientific Institute of Alternative Medicines and Paramedical Sciences Council in Delhi; National Institute of Acupressure Research, Training and Treatment in Chandigarh; Heritage Foundation, Baroda; Vishwa Chaitanya Acupressure Therapy Foundation and Research Center, Sholapur. All these institutes are involved in the mission. The 5 national conferences that were held in India since 2015. The first national conference was held at Aurangabad. The second and the third national conference was held in Mumbai. The fourth national conference was held in Surat, Gujarat. The fifth national conference was held in Bangalore. The sixth national conference this year was to be started in Jaipur and to end Jodhpur in Rajasthan and was to end in Mumbai. But due to the current pandemic, we are here online. And it is due to all of the therapists that we are celebrating this 6th International Reflexology Jain Association with the zest and valor. In the guidance of Editor-in-Chief Lokmat Group's newspapers, Rajendra Jidada, Lokmat Media has helped us to reach the masses of our country. So we are all here today to celebrate the 6th National Conference and the 1st International Week. So I welcome you once again to this wonderful morning. So today we start the program with a small prayer, with the intention and affirmation: all in this world are blessed and live a healthy life. Good morning.
भावना दिन रात मेरी सब सुखी संसार हो, सत्य संयमशील का व्यवहार बारंबार हो, धर्म के विस्तार से संसार का उद्धार हो, पाप का परित्याग हो, पुण्य का संचार हो, ज्ञान की सद्ज्योति से अज्ञान तम का नाश हो, धर्म के सद आचरण से शांति का भास हो, शांति सुख आनंद का प्रत्येक घर में वास हो, वीरवाणी पर सभी संसार का विश्वास हो, रोग भय और शोक हो वे दूर है परमात्मा, ज्योति से परिपूर्ण हो वे सब जगत की आत्मा, सब जगत की आत्मा, सब जगत की आत्मा.
Hello friends, a very good morning to all. I welcome you all to the international conference. For the best 5 years we have conducted national conferences. Hello friends, a very good morning to all. I welcome you all to the international conference. For the past 5 years we have conducted national conferences. This year we have organized for the first time international conference. Our main aim was to gather all therapists and to combine the knowledge of all the therapies so that all of us could benefit and pass the benefit to the patients. Our another mission was that we can carry out research work in the field of reflexology and target at healthy life without medicine 2030. We also importance to clinical data collective without which our research would have been incomplete. Prime Minister Narendra Modi has always insisted on digital India and we followed his path and implemented in our research. We collected clinical data of 40,000 patients and we are doing research work. I request the International Council of Reflexology to recognize the Jain Reflexology food chart at the universal chart. I request the International Council of Reflexology to recognize the Jain Reflexology food chart as the universal chart. So it has been our tradition celebrate Jain Reflexology Day, International Yoga Day, National Naturopathy Day, International Women's Day. We conduct free treatment and create awareness of all therapies. In 2020, due to Corona pandemic, to removing fear among people, we started 21-day online yoga campaign. During each day, we had different speakers who guided us on various topics like improving immunity, removing fear, healthy lifestyle, etc. Today we have eminent speaker with us who will guide us for healthy life. Thanks.
An ever-smiling person, a very down-to-earth person. I find immense pleasure in introducing our President, Professor Sir Dr. P.B. Lohiya. An ever-smiling person, a very down-to-earth person. I find immense pleasure in introducing our President, Professor Sir Dr. P.B. Lohiya, Indian Institute of Holistic Medicine's Anuprita. He is also on our advisory board. We are really thankful to him for taking out time from his busy schedule to attend the function. Dr. P.B. Lohiya, Indian Academy of Acupuncture Sciences run by Indian Institute of Holistic Medicines is the biggest acupuncture institute of its kind in India. It was founded in 1983 by Professor Sir. The Academy is affiliated to International Open University of Complementary Medicine Sri Lankan chapter. Indian Academy of Acupuncture Sciences has conducted many training and treatment camps in all major cities in India. The Academy also has its permanently treatment and training research centers at Bombay, Pune and Aurangabad. Dr. Lohiya established Indian Academy of Acupuncture Science in order to propagate acupuncture in India. He has been awarded with many international accolades for his great contribution in this field. In 1995, Dr. Lohiya and his wife Swati Lohiya had presented a paper in an international conference, China, which was awarded as the best paper in the conference. In 2001, they were honored with Honorable Friend of the Institute in Poland. They have also authored many books in acupuncture. He has been attending our conference regularly for the last 5 years. Thank you, sir. Thank you for being with us and please guide us.
The organizer of today's conference, the inventor of reflexology, Mr. Anil Jain, the members of advisory committee, Dr. Cyril, Antony, Mr. Fugue, and other dignitaries. I am very happy to welcome all of you to this international gathering. Because of corona problem, we are taking it online, but still something is happening. I must congratulate Mr. Anil Jain because all activities are practically paralyzed, not only in India but throughout the world because of corona. But Anil Jain has taken a bold step to arrange in this corona situation, so I again congratulate him. Mr. Anil Jain is from Aurangabad, so naturally, myself being from Aurangabad, I am proud of him. He is like my family member. He has not only invented Jain reflexology, but he has also taken a lot of trouble to popularize this throughout the country. I have been attending his conferences and giving lectures since last 4-5 years, every year. Sometime in Mumbai, sometime in Bangalore, sometime in Jaipur, here and there. So this movement is not restricted to only Aurangabad or Maharashtra. He is taking it throughout the country, and I am sure in a matter of time it will be Jain reflexology will be quite popular, not only in our country but throughout the world. He is going in that direction. He is taking a lot of trouble, I know it. Now, I welcome all of you to this World Reflexology Week and International Conference. I am happy that in spite of all these problems we are meeting, we are talking, we are listening to each other. Now, coming to acupuncture, it is said that acupuncture is a part of traditional Chinese medicine, TCM. But in my live interview at Beijing in the year 1995, I have claimed on China Radio International that acupuncture is Indian. India is the origin of acupuncture. The Chinese lady who was interviewing me, she said, Dr. Lohiya, we are thankful to you that you are popularizing Chinese medicine in your country. I said, sorry madam, I am not popularizing Chinese medicine. Rather, I am thankful to Chinese government and Chinese people for having accepted my Indian medicine in your country. I am proud that it is Indian in origin. Many times people ask, which is in Sri Lanka, I was asked the question, which is the mother of, who is the mother of acupuncture? I said, India is the first mother who gave birth to acupuncture, but China is the second mother who developed acupuncture. China has all the credit because all the scientific research, all the literature on acupuncture, it came from China. So we are rather thankful to China for developing our child, which is acupuncture. In Indian tradition and customs, there are many things which prove that acupuncture was there in India. The Indian female, which use various ornaments like putting ornament here, or they will wear bangles or anklets. All these are based on acupressure points. In acupressure, we know what is used, why it is used. Nowadays people think that it is tradition, it is age old, but I proudly tell you that behind all these so-called age old traditions, Indian customs, there is a science, it is scientific, and I am proud because that science is nothing but acupressure, which is our science. In Indian language also, there are many terms which we are using. For example, in Marathi, if somebody is having burning micturition, in Marathi we say unhani lagli. Unhara means summer. Unhani lagli means because of summer heat, there is burning micturition, which in allopathy we may label it as urinary tract infection. But in all Indian villages in Maharashtra, we call it unhani lagli. That means people were knowing this concept that because of summer heat, there can be burning micturition, which is a concept of acupuncture. In Hindi, we say, it is a common proverb. Gusse se andha ho gaya means excess anger makes one blind. It is commonly said, it is a common proverb in India, throughout India, in Hindi speaking area. Now this is a concept of acupuncture, that if somebody has excess anger that disturbs the energy, the chi of liver is supplying the chi to eyes, so excess anger may damage the eyes. This is the concept of acupuncture, and we say, gusse se andha ho gaya. We also say in Hindi, khushi se pagal ho gaya, means excess joy makes you mad. This is also a concept of acupuncture. According to acupuncture, if the energy in heart chi is disturbed, if it is heart chi is disturbed, it makes the person mad. And according to acupuncture, excess joy disturbs the chi of heart, which in turn makes the person mad. And this is a common proverb in our language. Coming to acupuncture again, acupuncture and acupressure and our Jain reflexology, all these are drugless things, drugless therapy. Many times people say that, oh, that works, we know. But what is the proof that it works? See, according to me, in one of the conferences I had told that man was born first, human being was born first, and human being created science. Things started first. In one international conference, one allopathic doctor said that all these so-called alternative medicines should be banned because they are not scientifically proven. In that conference I said, Adam and Eve, the whole world, it started from Adam and Eve, who never went to medical college, they never learned reproductive system, they didn't know anything about science, but the human being has come into existence. I told him, all the allopathic doctors, they go to medical college at the age of 18 years. We learn, I am also allopathic doctor, we learn anatomy, physiology, how heart works, how kidney works at the age of 18. But all of us, without not knowing any science, whether it is doctor or lawyer or anybody, all of us, without knowing the science, we have been using our all organs since birth. So what people know, what people want is not science, they want results. If somebody, say one allopathic doctor, he has some problem, he is taking allopathy, no use, he is taking say Ayurveda, homeopathy, acupuncture or anything. And if he is not relieved, and if somebody tells him that there is one so-called Sadhu Baba sitting on the mountain, you go to him, touch his feet, he will give you some prasad, he may tie some black thread on your arm and you will be alright. That's so this allopathic doctor or whoever, any person highly educated, not relieved by any other scientific therapy, will go to that Sadhu Baba, may go in dark in night, so that others should not see. But, so what I mean to say is, what people want is relief and only relief. That relief may come from allopathic medicine, homeopathic medicine, Ayurvedic medicine, or acupuncture needle, or magnet, or Jain reflexology, anything. What people want is relief. Regarding science, the discussion should be among doctors and scientists, but people will not wait for you. For example, if we tell people, common man, that if you press here, headache will vanish. The man will use it. He will not ask how does it act. But still, this does not mean acupuncture is not scientific. Then I am very happy to tell you that it has been proved beyond doubt that acupuncture is scientific, and I am very proud to tell you that this was proved in China on 25th November 1987 on my left hand. Professor Jain of China is inventor. He invented the scientific aspects behind acupuncture point and acupuncture meridians. He found out that acupuncture points and meridians are having low electric resistance and hyperresonance or alternaresonance. When I was in China in 1987, this professor who is my friend, one day he came to me, he said, Professor Lohiya, you come today night at 12 o'clock to my research center. I will send you a car. Don't tell anybody because China is a communist country. We are not allowed to disclose anything without government permission. But I will send you a car. Don't tell anybody. Come at 12 o'clock. I went there and he showed me one machine. He said, I have proved that acupuncture points are points of low electric resistance. And to prove it with this machine, I will draw heart and lung meridians on your hand. He gave me one electrode in one hand. He started moving the other electrode on my hand. He said, if you get a shock-like sensation, you raise your finger. He asked me to close my eyes. I was sleeping there. I was sleeping with my eyes closed. He started moving the electrode. And whenever I used to feel shock, I used to raise my finger with a pen, with a sketch pen. He drew heart meridian and lung meridian on my left hand, and I was shocked to find that the diagram of these meridians given in Huangdi Naijing, a book which is 5,000 years old, were matching with the diagram drawn on my hand. So what I want to tell is that it is proved beyond doubt that acupuncture is having a science behind it. It is not something like a magic. It is not only effective, but it is scientific. And in India, I told you that it is Indian in origin. I am proud to tell you that acupuncture was taught as Suchi Chikitsa in Takshashila and Nalanda universities, which are very, very ancient Indian universities. According to acupuncture, we have got 14 main meridians. Actually, there are 20 meridians, but 6 meridians don't have their own points. So there are 14 meridians, 12 bilateral meridians and 2 midline meridians. The energy, the whole science is based on the concept of energy, which in Chinese we call as Qi. In Indian language we call it Chetana or Pran Shakti. Ayurveda is also based, Ayurveda, Reflexology, acupuncture, all these are based, naturopathy, they are all based on energy, concept of energy. Except allopathy, all the sciences, they believe in energy and prana. According to acupuncture, the vital energy, which is called Qi in Chinese and vital force in homeopathy, Chetna or Pran Shakti in Indian energy based sciences, including Ayurveda, naturopathy, we call it Pran or Chetana Shakti. So, except allopathy, all pathies believe in Qi, that is vital energy. One press reporter asked me, why you allopaths don't believe in Qi or Pran? I said, we allopathic doctors, we learn anatomy of the body by dissecting dead bodies. And dead body does not have prana or energy. So, we don't believe prana or energy. We are taught like that. But whether we believe or not, Qi has to exist. There are many things in the world which may or may not be scientifically explained, but we have to believe their existence. That is without doubt. So in acupuncture, according to acupuncture, energy is flowing in these 14 meridians. Whenever there is a block in the flow of energy, see, this is our skin. Meridian is below the skin. Like below a road, there is a gutter. Below a road, say there is a pipeline or gutter. If there is some obstruction in the gutter, block in the gutter, the water will not flow. There will be stagnation. Like that, whenever there is an obstruction in the meridian, there are many causes of obstruction. Whenever there is obstruction in the meridian, there is stagnation of energy in the meridian. It is not flowing. Where there is stagnation, the part of meridian after the stagnation will not get energy. It may result into paralysis or weakness of that part, non-functioning of the part, paralysis of the part, or tingling and numbness of the part. And the part of the meridian, part of the body, prior to stagnation, prior to the block, at that point there will be pain because of stagnant energy. So in pain and paralysis particularly, the cause is block in the flow of energy, and what we do is we remove the block with acupuncture needle, that which is puncture, or by acupressure. Now acupuncture points, what is acupuncture point? Basically the whole meridian is a line of low electrical resistance, and at acupuncture points this resistance is further low. So in short, acupuncture point is something like a window to the skin, from where anything can enter the body very quickly. So whenever there is a block in the meridian, we insert our needle through this window, through this acupuncture point, and we move that needle, lifting and thrusting or rotation. And nowadays, because we have got electricity operated machines, battery operated machines, we stimulate the needle with the help of electric current. The movement of needle removes the stagnation. Then systemic disorders, means disorders of liver, heart, kidney or spleen or lung. These disorders are due to imbalance in the five elements. According to acupuncture, the body is made up of 5 elements. In Ayurveda also the concept of 5 elements is there, but those 5 elements are different and our 5 elements are different. In 5 elements there are 2 types of cycle, constructive cycle and destructive cycle. So what is a disease? This is between the five elements, or this is between yin and yang. In our vital energy, in our chi, there are two types of forces, two categories, yin and yang. Yin means negative and yang means positive. Whenever there is imbalance between yin and yang, it can cause a disease. So this is between yin and yang can cause disease, and acupuncture can maintain the balance between yin and yang. Most of the disorders say like fever, they are due to imbalance between yin and yang. According to acupuncture, pathogen is yang, any bacteria or virus is yang, and immunity is yin. Where there is imbalance, if the immunity is weak or pathogen is more, the person gets fever. And this we can balance we can treat with acupuncture or acupressure by balancing yin and yang. Then third next cause of disease, imbalance between five elements I told you, all the systemic disorders. Systemic does not mean only these five organs. For example, according to acupuncture, liver is related to eyes, muscles and tendons. So they also, diseases of eyes also come in systemic disorders. Or lung is related to skin and nose. So skin and nose problem come under lung. Or heart is related to brain and blood vessel, and so on. Kidney is related to. There are some types of cycles I told you. Normal cycles are constructive cycle, destructive cycle. When these two cycles are in balance, there is no disease. But if acting cycle becomes overacting, it may cause overacting cycle. Or if the other organ, other element becomes weak, the other one may call counteracting and overacting. So we can treat all systemic disorder. And now I am allopathic doctor. In allopathy, for all these systemic disorders, for majority, 99% disorders, there is no cure except fever. I have made this statement in London. The Royal College of Physicians London had invited me for lectures. All audience was highly qualified allopathic doctors. There I told that we allopathic doctors have a lot of ego. We think that we are like God or next to God. But if we honestly think, I told them, close your eyes, keep your hand on your heart, and honestly think, which disorders you can treat in allopathy. Treat means cure, not manage. And the answer is, except bacterial infection, we cannot cure a single disease. And this COVID-19 has exposed allopathy very badly. Nothing can be done in allopathy. Not only COVID-19. In allopathy, we can treat only bacterial infection for all other disorders, say like bronchial asthma or hypertension or diabetes. What we are doing is just temporary treatment, symptomatic treatment, or for even painful disorders, what we are doing. Suppose the patient is coming for knee pain. We take a beautiful X-ray, we tell that there is lack of lubricant fluid, the bones are brushing against each other, so there is pain. But in allopathy, we don't have any medicine which can increase the lubricant. So what we do, we give a painkiller. And what is a painkiller? Painkiller does not allow the brain to pursue the pain. Well, this is nonsense. And this is, many people ask me, why you left allopathy? Actually, I was having maternity surgical hospital, very good practice in allopathy. But this is one of the main reasons why I left allopathy, the painkiller concept. Suppose some house is burning, set on fire. The treatment should be called the fire brigade and extinguish the fire. Now in allopathy, what we are doing, instead of treating the root cause of the problem, we say, oh, the house is on fire. Close your eyes so that you don't see the burning house. So I could not, I was getting irritated. This is the main reason why I left allopathy. Actually, acupuncture is the best painkiller. It has been scientifically proved that the action of acupuncture, it competes with the morphine and pethidine of allopathy. Much higher than routine painkillers. In China, earlier they were doing acupuncture and they were doing operations under acupuncture anesthesia. Action of as the painkiller is very strong, but still in my practice, I believe don't suppress the pain, find out the cause of pain. Pain is a boon to the patient. Pain is a warning signal to the patient, to a person, that there is something wrong in your body. Go to a doctor, find out what is wrong, what is the cause of pain and treat. For example, if patient is having knee pain due to lack of lubricant, find out which pathy can increase the lubricant, and I am happy to tell you that pathy may be anything except allopathy. It may be acupuncture, it may be acupressure, it may be reflexology, it may be anything, but at least in allopathy we cannot do it. So, but if somebody wants to use acupuncture as a painkiller, acupuncture can be used as a painkiller. Now coming to the bacterial and viral disorders, infections. Actually, in day-to-day practice, when we are eating something, lakhs of bacteria are entering with food. When we are drinking water or any cold drink or anything, again thousands of bacteria are entering. When we are taking oxygen, when we are doing respiration, thousands and lakhs of bacteria are entering in our body. So far, at least no company has prepared any filter here that no entry for bacteria or virus. Had we prepared, probably it might have helped for our COVID-19, but not possible. So what I want to tell you, that in routine life, bacteria and virus of all infections, not only COVID-19, it may be swine flu, it may be plague, it may be AIDS, it may be anything. All are in this hall, in the atmosphere. They are attacking your body. They are trying to enter your body through all the openings of the body, including naturally the main openings are our nose and mouth. But still, we are not ill every day because in our body there is immunity. There is a fighting force. Immunity is like a militaryman or policeman which is fighting with bacteria and virus. Now, in acupuncture, it is called Weiqi, W-E-I-Q-I. Weiqi means the defensive chi. According to acupuncture, it is covering the whole body, it is covering the whole openings, it is covering all the connective tissues, sense organs, muscles, tendons, bones, everything. All they are protected. And again I come to Indian origin. If you find the pictures of, say, Ram, Lord Ram or Lord Krishna or Gautam Buddha, anybody, in photo you will see a big aura drawn around Ram or Krishna or Buddha or Mahavir Jain, anybody. Now what is this? This aura, which nowadays can be recorded with Kirlian photography. This aura, this concept was there in India. According to acupuncture, this aura is Weiqi. It is nothing but Weiqi. So if a bacteria or virus has to attack your body, the Weiqi or this aura, so-called aura, that will also fight with the bacteria and virus. Now, coming to COVID-19, before that I will tell about one or two more things about acupuncture. So acupuncture, what can acupuncture can do is, acupuncture can enhance the immunity. Acupuncture, we are coming to that. In allopathy, what we do, if somebody is having fever, we give antibiotic to kill the bacteria. Virus we cannot kill. And that is problem with COVID-19. We give antibiotic. Now, what is the meaning of antibiotic? Anti means against and bio means life. It is against the life. Not only of bacteria, it may be against the life of the patient who is consuming that antibiotic. It is antibiotic, it is not antibacterial. It is antibiotic, means against life. So a person can die due to side effect. We call it side effect, but it can be even death. So in allopathy, we are killing the bacteria, but in acupuncture or other sciences, we are increasing the immunity, which in turn will kill the bacteria. In one conference, one press conference, one press reporter asked me, Dr. Lohiya, can you treat tuberculosis with acupuncture? I said, yes, of course, we treat. He said, do you kill bacteria with acupuncture needle? He wanted to make a mockery. Are you killing with acupuncture needle? I said, no, we don't have to kill. We increase the immunity, which in turn, just I give one reference, Mr. Jain, I take them generally, I don't take names of patients, but Jain himself, who was income tax commissioner here at Aurangabad, he himself has quoted this case in our international conference held at Aurangabad. His wife was diagnosed by the best allopathic hospital at Aurangabad as a case of pulmonary tuberculosis. They started allopathic drug. She did not respond, and then Mr. Jain came to me and he said, stop this allopathy, you treat with acupuncture, I am sure that you can cure it. And I am happy to tell you that with only 15 days of acupuncture and followed by 2.5 months acupressure at home, the patient was 100% cured. She started responding from the very word go. After 3 months, I asked Mr. Jain to repeat all the investigation in the same hospital at Aurangabad, and all were shocked to find, all means allopathic doctors were shocked to find that all investigations were 100% normal with the treatment of acupuncture and acupressure. So what I mean to tell is that because we can increase, we don't have say ki different points to treat TB and different points to treat malaria. What we are doing is we are increasing the immunity. The same points will be useful to treat COVID-19 virus. Then in acupuncture, we have analgesic action, I have already told you. We have homeostatic action. Homeostasis means whatever is less can be raised and whatever is more can be reduced. Suppose somebody is having high blood pressure, we take these homeostatic points, the blood pressure will come to normal. The same points will lift the blood pressure in a case of hypotensive patient. The same points for high blood sugar, low blood sugar. The same points for hypothyroid or hyperthyroid. The same points for excess sweating or anhidrosis, that is no sweating. This is called homeostasis. So if there are 4 important points for homeostatic points, if you are doing puncture or pressure at these points, your blood pressure, respiration, respiratory rate, your heartbeat, your blood sugar, your enzyme, hormone, everything can come to normal without giving any drug. And this is a wonderful action of acupuncture. Apart from this, acupuncture has motor recovery action, so we can increase the size of muscle, we can increase the number of muscle fibers, and also we can stimulate the muscle fibers we are not active. So in any paralysis or motor neuron disease or myopathy, in all these conditions or post-polio paralysis, we are hemiplegia, paraplegia, Bell's palsy, where acupuncture is very, very effective. Apart from this, it has got sedative action. There are some points in acupuncture which cause sedation. They cause sedation. There are some points which are tranquility point. So in short, why I went into detail, because one person had asked me, one press reporter, because the general feeling is that to treat any disease you need a drug. That's why all clinics are having a board, Dawa Khana. In Marathi or Hindi, we call it Dawa Khana, means consuming medicine. This board is put up at all medicine. That press report asked me, you are not eating anything, you are just pricking or pressing some points, and how is it Dawa Khana? How can you treat it? It is difficult for anybody to treat. That's why I went into details of how does acupuncture act. And now coming to our today's topic, Corona. Now, Corona, this COVID-19 is the burning problem of the day. It has practically paralyzed the whole world. Not only India or America, the whole world is practically paralyzed. All of us are having a big problem, particularly because people believe only allopathy, which has nothing to offer. I tell you one thing. Few months back, when COVID-19 started, government declared that COVID patients should be treated only by allopathic doctors. Doctors of alternative medicine should not even claim prevention of corona. It was strictly banned. So I had to remove some post. I had put some post on Facebook. Okay, how to improve immunity with acupuncture. My son told me, sir, Papa, please remove that post. Otherwise, government will arrest you. But now, government has come to know that allopathy cannot cure corona because it is a virus and we don't have any drug to treat coronavirus. So now ultimately government has also come to a conclusion that let other pathies give a chance. Government, our Ayush Ministry under Department of Medical Education, they have formed one COVID-19 force. Maharashtra government has formed. And I am happy to tell you that government has appointed me on that body. And now we are discussing we have all options: Ayurveda, homeopathy, Unani, acupuncture, acupressure, reflexology, or whatever it is. Means government now wants that other pathies. Now government is not asking about scientific proof. Now they are saying, come, all of us should work together. And in today's meeting only, there was one suggestion that we are coming with some guidelines. Okay, if there is a patient of COVID, these 2 drugs of Ayurveda, these 2 drugs of homeopathy, these 2 drugs of Unani, or these 4 points of acupressure or acupuncture. Like this, we are having a common program which is bringing together all pathies to fight with corona. Now we are digging the well of alternative medicine because we are thirsty. So far, allopathy was everything, but now because we have come to conclusion that allopathy cannot fight with corona, mainly because allopathy cannot increase the immunity. Now what, according to acupuncture, now coming to COVID-19. COVID-19 is a virus and it has a strong immunity, affinity for our lungs. The virus tries to enter through our nose, it stays in nose for a few days, then its second stop is in our throat, again few days there, and then it tries to attack the body. Lung is the third pattern. For example, if you are going to attack a place which is far away, we take 2-3 stops. So first of coronavirus, first stop is nose, second stop is throat, and ultimate stop is lung, and there are many other stops according to acupuncture. Now, not only corona, but all this systemic, this bacterial or viral disorders, I told you that they are due to either lack of immunity or because of excess of pathogen. The pathogen in corona is COVID-19 virus. According to acupuncture, there are 2 types of syndromes of corona. Yang syndrome of excess type. Yang syndrome of excess type means the pathogen is, in reality, it is too much excess. So it may attack even a person who is having normal immunity, which is not able to cope up with that virus. The patient immunity is okay, but virus is overpowering that immunity. So even a man having normal immunity can be affected. That is called Yang syndrome of excess type. Now how to identify? In Yang syndrome of excess type, the patient will have, all of a sudden he will have fever. All of a sudden patient will have fever. So the onset of the disease is all of a sudden in Yang syndromes. In all, not only about corona, in all or diseases, bacterial or viral disorders, when the cause of disease is excess of bacteria or virus, the patient all of a sudden gets high fever. It may be plague, it may be typhoid, it may be corona, it may be any infection like this. Then other type is Yang syndrome of deficiency type. Means virus or bacteria is not excess, but the immunity is low, so even a normal bacteria or virus can attack the body because the defensive system is very weak, very poor. And let me tell you, tuberculosis is a disease of in type. In tuberculosis, patient never gets all of a sudden fever except in tuberculous meningitis. In all others, say pulmonary TB or TB of kidney or TB of skin, the fever is of acute, is not of acute onset, it is of insidious onset. Particularly if you think of tuberculosis, when I was in medical college learning in my MBBS days, I asked my professor, sir, in tuberculosis patient gets fever, fever means evening rise of temperature and cold night sweats. What is the cause of this? Why a patient of TB gets fever only in evening and cold night sweat, cold sweat only in night? My professor got very angry, mainly because he did not know the cause and he was being exposed rather. He said, nonsense, you are not reading the book, it is given in the book of medicine. I humbly replied, sir, I don't think that the bacteria of tuberculosis are reading our book of medicine, so probably they don't know that they should attack only at night. And the result was, he asked me to leave the class. He did not attend me to attend the class. He didn't allow me to attend the class for next 6 months. I was punished because my professor was ignorant about the cause. But now when I came to acupuncture, I found out the cause. Acupuncture, this tuberculosis is a in disease. In means immunity. Weak immunity is the cause of tuberculosis. The poor bacteria we are blaming, but bacteria should not be blamed. The tuberculosis is because bacteria is not high. 8 to 10 persons are sleeping in one room, one person gets tuberculosis. Doctor says it is due to bacteria. The person will ask, we 10 people are in the room, why me? Why only me? Why the bacteria has spared others? So in short, bacteria is not responsible. The low immunity of the person is responsible, and this is called in syndrome. So in corona, we have two syndromes. One is Yang syndrome of excess type, which is due to excess of coronavirus, that is COVID-19 virus, in which there will be acute onset, all of a sudden there will be fever, the symptoms will be strong. If there is cough, cough will be strong. If there is rhinitis will be strong. But in Yang syndrome of deficiency type, the disease comes slowly, insidious onset. We can't locate if the person has corona at this time. It may be detected at a particular time by the pathologist, but patient himself doesn't know that when did the disease start. And nowadays in allopathy, we are talking about asymptomatic cases, many asymptomatic cases. And according to me, all these so-called asymptomatic cases showing COVID positive, they belong to this category, Yang syndrome of deficiency type. This I have already told in our meeting last time. So in Yang syndrome of deficiency type, which is due to low immunity, the symptoms will be slow in onset and fever may be usually absent. Patient may have at the most fevering sensation. It enters through the nose and mouth. It enters through nose and mouth. I have also told you it stays in nose for few days, throat for few days, and then it attacks lung. Allopathy knows only this much. Nowadays, many people are coming with different variety of symptoms. 2 days back, somebody put on fracture on Facebook that one physician told that except fracture or pregnancy, there can be any symptom of corona. Because according to allopathy, it is limited only to lung, but according to my thinking, based on acupuncture, it is not limited only to lung. According to acupuncture, when it attacks the lung, the symptoms will be rhinitis, that is running of nose, pain in throat, because throat belongs to lung, hoarseness of voice, cough, dyspnea. Dyspnea means breathlessness. If there is dyspnea, that is a bad symptom. Patient must be admitted in the hospital because he may need oxygen. The oxygen level is dropped out. Then skin rashes and loss of smell. Now, patients of COVID are coming with skin rashes. Allopathy can't explain why there can be skin rash in COVID. Acupuncture can explain because I just now told you that the skin is related to lung meridian. So the virus which is attacking nose, throat and lung all are parts of lung. Likewise, skin is also part of lung. So there may be skin rash which allopathic doctor doesn't understand, may not accept, but that is the cause. And one more thing, loss of smell. Here also allopathic doctors don't know why there is loss of smell, because according to allopathy it is related to brain. How this virus is attacking the brain, they are puzzled. We as acupuncturists, we know that smell is related to lung. Smell is related to lung because nose is related to lung. So if somebody has a loss of smell as a symptom, that means lung has been affected. Now, according to acupuncture, there is a vicious cycle. I have thought this. According to me, there is a triangle between lung, liver and spleen. The energy of lung drops down. Energy of lung drops down. Now, lung and liver are controlling each other. Because the energy of lung drops down, the energy of liver goes up. That increases heat in liver. Nowadays, we are finding some patient who tell that I am getting irritated due to corona. So, I am getting headache due to corona. So, this is mental irritability, migraine type headache, hyperacidity, and pain in muscles. Many patients are complaining extreme muscular pain due to corona, and allopathy cannot explain why there is muscular pain. According to acupuncture, this muscular pain is due to heat in the muscle, heat in liver, excess heat in liver, causing hyperacidity, muscular pain, migraine-like headache, irritability, and vomiting or vomiting sensation. All these suggest, according to acupuncture, that not only lung, liver has also been affected. And then if liver energy goes up, the spleen energy goes down. According to acupuncture, liver is wood and spleen is earth. Excess wood, it overacts on earth. Spleen goes down. Now, the patient may have symptoms related to spleen. Somebody may have loss of appetite or loss of taste. Allopathy is still thinking why there is loss of taste in coronavirus. What it has got to do with taste? According to Dr. Lohiya, loss of taste or loss of appetite or indigestion or loose stool, all this suggests that the spleen energy has been affected. It has gone down. So according to me, this is the triangle now. low energy in lung, causing high energy and heat in liver, in turn causing low energy in spleen. This is the triangle. I have explained you all the symptoms. Some people of corona get extreme fatigue, muscular fatigue. If it is muscular fatigue, that means, because spleen is also supplying muscle and tendons. Muscular fatigue means spleen is weak, and muscular pain means there is heat in liver. That way I differentiate these symptoms. Medicine doctors are puzzled because of these symptoms. I told you about that post that except fracture in pregnancy it can cause anything, because they don't know the cause. But on the basis of acupuncture, we know the cause. So to repeat, excess muscle fatigue means spleen is affected, and excess muscle pain means liver is irritated due to excess heat. So these are various symptoms. And now coming to the vicious cycle. According to acupuncture, spleen is the mother of lung. So if the spleen is weak, lung becomes further weak. Naturally, more heat in liver, spleen becomes further weak. So according to me, this vicious cycle between lung, liver and spleen, it results, if not treated properly, it may result into death of the patient. So if you want to treat the patient, we have to break this vicious cycle. And now we will talk about treatment part of corona. Now coming to the line of treatment or prevention of corona. Acupuncture and acupressure can be used for both prevention or treatment of mild or moderate cases, but not in very severe cases. In cases severe, it must be admitted in hospital because anything can happen. The patient may need oxygen and other things. Now, line of treatment number 1, we should increase the immunity. I told you in my lecture that if you increase the immunity to such an extent that it overpowers the virus, then virus cannot do anything. So number 1, increase the immunity of the patient. Our main treatment is that. Now there are many research papers on this, particularly in China. It has been scientifically proved that there are some acupuncture points which, when stimulated, they increase cytokines and CD4 plus count, thereby increasing immunity. So it has been scientifically proved. Long back, there are many research papers even regarding treatment of AIDS with acupuncture and acupressure. Same. What is AIDS? Immunity deficiency syndrome. And when we can increase immunity, which allopathy cannot, we can treat even AIDS. So there are many research papers on treatment of AIDS with acupuncture. Anyway, that is first line of treatment. Then to increase energy of lungs. Because this virus, COVID-19 virus, has affinity for lung, that is lungs. Now, according to acupuncture, I told you, lung means nose, throat, whole respiratory tract, including lung. So, what we have to do is not only increase immunity of the body, in addition, we have to increase the chi of lung. Because whenever any pathogen, it overpowers the Vechi, aura, everything, immunity, and enters the organ, attacks the organ. It is the chi of the organ which is fighting, that time immunity is of no help. Immunity is of help at the early part, when the bacteria, for example, our body is like a fort. Fort has got gates and soldiers guarding the gate. Our immunity is the soldiers guarding the gate of the fort. They will fight at that level. Once the say immunity is less or pathogen is more and pathogen has entered in the fort. Now meridian is the pathway going to the king's palace. Their energy of the meridian will fight with the pathogen and not the immunity. So we have to increase energy of the meridian, because this pathogen, which is the invader, which wants to attack the king, is going to king's palace via meridian. So there, the energy in the meridian will fight with that energy. This chi is called as Jain chi. Immunity is Wei chi, this is Jain chi. And then if that fight is not sufficient, then the pathogen will attack the king's palace, that is lung organ. In organ also there is energy of the organ. That time all the chis of the body, Wei chi, Jain chi, all types of Yin chi and the chi of the organ, all will come together to save the king. So what I want to tell you that, in addition to increasing immunity, we have to increase the chi of lung organ as well as lung meridian. And then this is particularly important to treat Yang syndrome of excess type, because Yang syndrome of excess type is dangerous for the lung, because pathogen is very strong. In spite of normal immunity, it can attack dangerous type. So in Yang syndrome, the energy of chi in lung must be very strong. And then in advanced cases, as I told you, that in the cycle, the lung chi may affect energy of liver may affect the energy of spleen. So we have to treat the energy of liver and spleen also, depending upon the symptoms. For example, if somebody says that I am getting irritated or having vomiting or I am having muscular pain, we have to take points related to liver. If somebody says that I have lost the taste of food or I am getting indigestion, loose motion, muscle weakness, that means spleen is affected. So we may have to tonify the energy of spleen and stomach and like that. So this is line of treatment in corona. And now I will explain you the points. There are some important immunity points in acupuncture, and the most important point is on the neck. Point just below 7 cervical vertebra. These 7 cervical vertebra. If you bend your neck, and pass your hand like this, you feel one moni prominence here. This is vertebral prominence of 7 cervical. Point DU14, Dazui is the Chinese name. It is just below 7 cervical vertebra. In fat people, very obese people, you may not find the vertebra. You can't find any bone in obese people. So the point is 4 fingers below this hairline. 4 fingers below the hairline, this point is DU14. This point is the best immunity improving point of acupuncture. Rather the best point of acupuncture. It increases immunity to such an extent that we in acupuncture call this point as antibiotic point of acupuncture. This DU14 acts like antibiotic. It is also anti-allergic point, anti-pyretic point, it is anti-inflammatory point. It is one of the best point, rather the best point of the body. Then second point is Kuchi or LI11. If you flex, this is called flexion. If you flex the elbow, the point is at the outer end of this elbow crease. This point is Kuchi or LI11. This point. This point increases immunity It is also homeostatic point. DU14 is also homeostatic point. This is also homeostatic point. Li11. And because according to acupuncture, lung and Li are related to each other in yang. If you tonify this point, it will increase not only immunity, it will increase the immunity, the chi of lung also. Then third point, Bhujali, stomach 36. This point, below our patella bone, there are two depressions here, they are called knee-eye. This depression is called knee-eye. Point stomach 36 Bhujali is 3 thumb or 4 finger below this depression. This depression, 4 finger and 1 finger lateral to this bone. It is 1 finger lateral to lower end of tibial tuberosity, or if the patient keeps hand like this on patella, the head, it is at the tip of the ring finger. If this middle finger is on the bone, the point Jhujali is at the tip of the ring finger. Point stomach 36 Jhujali. In Chinese, San, SAN, San means 3. It is 3 tune below the outer depression, so it is called Jhujali. Jhujali means 3 measures or 3 miles. The next point, San Jiao spleen 6. San in Jiao. San in Jiao. San means 3, in means in meridian, Jiao means crossing or junction. It is a junction point of 3 in meridians of lower limb, so it is called San in Jiao SP6. Along with DU14, it is the best point of the body. The point is 4 finger or 3 thumb from medial malleolus, tip of medial malleolus, 4 fingers. This point is spleen 6. The best point of the body. This point is also anti-allergic point. It is immunity point, homeostatic point, tonification point. So many uses of this point. It is one of the best points of the body, rather the best, spleen 6. Then these 4 are very important points. Apart from this, there are many other points. Next point, range 6. Range 6 is 2 finger below the umbilicus. These are umbilicus or navel. From navel, 2 finger below, this is the point. Range 6. Chi hat. 2 finger from the center of the umbilicus. The name of the point is Chi high. Chi means energy, high means C. C of energy. It is the best tonification point. It increases immunity, it is the best tonification point of the body. So particularly in patients who are having muscular weakness or overall weakness, in addition to increasing immunity, this point will reduce weakness of the patient. Then Li4 point. Li4 point, if you ask the patient to bring this index finger and thumb together, you see a prominence here. You see a prominence here. This prominence, at the top of prominence, this point is Li4 or Hebo. The Chinese name is Hebo or Hoku, the great eliminator. This point. It increases immunity. It also increases energy of lung, because I told you lung and Li are related. And most important, it is the best painkiller point of the body, Li4. I told you about acupuncture anesthesia. The first operation under acupuncture was tonsillectomy done with only needle at Li4. The ENT surgeon removed tonsils by just putting a needle at Li4. So it will increase immunity, it will increase energy of lung, and in the patients who are having muscular pain or body ache, for that also Li4 will be useful. So I have told you about these 6. There are many points which increase immunity, but instead of going for all points, these 6 are of multiple use, means apart from immunity, they are having other uses like homeostasis and tonification or increasing lung of chi, this and that. So these 6 I have chosen as the most important points to increase the immunity. And now what we can do? If you are doing prevention, then even acupressure is enough. If you are treating, then acupuncture is better, because acupuncture has got a strong action. But acupuncture will need a doctor, qualified person who is expert in acupuncture. Acupressure even patients can do at home. That is advantage of acupressure. So what patient can do is take any seed, maybe jawar seed or methi seed, methi dana or any seed, and take this adhesive tape, paper tape, put seed on that and fix the seed at the point with the help of paper tape at these 6 points, or if you want less point, the first 4 points, they are most important. Fix after taking bath in morning, fix seeds at these points, and then daily morning and evening you can do acupressure at these points. You can do acupressure either like this, or you can do clockwise acupressure like this for say 1 to 2 minutes in morning and evening. If you have plenty of time now, because of corona, many people at home, they have nothing else to do, so they can keep on doing acupressure as much as they want, as long as they want, because there is no side effect of excess of acupressure or acupuncture. There is no overdoses. In allopathy, if you take more tablets, there is overdoses. In acupuncture, acupressure, or even reflexology, there is nothing like overdoses. Then acupuncture points, this we have finished. Points to increase lung chi. I told you that lung has to be protected because the virus has got affinity for lung. It is likely to attack the lung and damage. Now we see many cases of fibrosis of lung. Fibrosis means damage of lung. The pulmonary capacity of lung reduces. Patient gets breathlessness. Then is admitted, he or she, in the hospital. We put on oxygen. That too may or may not work. Because personally, according to me, oxygen may not work because the pulmonary capacity has gone down. Oxygen is not less in the atmosphere. The capacity of lung has gone down. The vital capacity because of fibrosis of lung. So what we have to do to protect the patient? We have to take point of lung. The best point of lung is lung 9, this point. It is at the outer end of the lung, this crease, the wrist crease, outer end, this point Taiwan or lung 9. It is a very important point, one of the life increasing points, lung 9 point. It is the best point because it is mother point as well as Yonso's point of lung. Means the maximum energy of lung meridian is stored at point lung 9. Apart from this, this point is very effective to prevent heart problems because it is the influential point for blood vessels, and most of the heart problems are related to coronary artery. Then next point, range 17. Range 17 is on the chest. This bone is called sternum or breastbone. The point is on the chest between the two nipples here in the center. Range 17 point. Now the next point to increase energy of lung is range 17. The point is on this bone sternum, exactly between the two nipples in the midline. Point is here. This point is influential point for lung. It is influential point lung. So it is useful to increase the energy of lung. It is also related to pericardium, so it is indirectly, it also helps to prevent heart problems. Then points to normalize liver and spleen. These are not routinely required. Liver point will be required if patient has got, I told you, headache, irritability or body pain or vomiting, then you add liver 3. Liver 3 is on the leg, 3 fingers from this web margin, 3 fingers between this bone and this bone. These are called metatarsals. First and second metatarsal, 3 fingers from here, liver free. It reduces heat of liver and it will protect liver from being damaged. And then if symptoms are related to spleen, we have to add spleen 6. As I told you, loss of taste, loose motions, muscular weakness, indigestion, that means spleen is damaged. But this point we are already taking as an immunity point. So it is already covered. So in short, we have discussed how to treat. And now what we can do regarding this. Because see, remember, when we are treating or preventing corona, we are also doing a great social job. We have got some particular duty. So acupuncture treatment can be, what I have demanded is, acupuncture treatment can be administered in all hospitals in addition to routine treatment. Some of patients are taking allopathic medicine in the hospital. In addition to that, we can add acupuncture treatment which will be carried out by experts in acupuncture. Then qualified acupuncture practitioners can be allowed to start acupuncture immunity clinics to prevent. We increase immunity to prevent the corona, and if there is corona, we can be treated if it is a mild case or moderate case, but not severe case. I have already told, if it is severe case, it must be referred to hospital. And then mass education. Acupressure is best for mass education. So I have requested government that people can be guided to increase immunity by doing self-acupressure. We can publish articles, we can conduct webinars, may be undertaken as a project by government, Maharashtra government, Indian government, or any foreign government also. Because this is an international conference, not only of Maharashtra or India. So this message should go to all the world, international people. In your country, you can do mass education of public, because acupressure, by way of acupressure, all the people, there is no need of doctor. Common man can increase immunity, can prevent the corona by using acupressure at the said points. And this mass education will be very, very effective. So government, all government, not only India, I request all the governments in the world to take this mass education of increasing immunity with acupressure very, very seriously. So now we come to end, because I have spoken a lot. Again at the end, I congratulate Mr. Anil Jain for popularizing Jain Reflexology, for giving me a chance to come here and talk to you all and to popularize treatment and prevention against corona. I wish best luck for this conference. Thanks, Dr. Anil Jain. Thank you very much.
Thank you for your very helpful tips that each and every one of us can benefit from. So let's give a warm round of applause. You have made a difference. Thank you so much. It's my honor today to introduce to you Cyril Antony from Sri Lanka. Sir is the chairperson of Education Committee, is a practitioner of alternative medicines including reflexology, acupuncture, acupressure, reiki, yoga, chest massage and other massage therapies. He studied reflexology when he was studying acupuncture at the Open International University for Complementary Medicines. He has been practicing reflexology for about 29 years and teaching reflexology for about 12 years. He first joined the ICR as a member in 2010. Sir, please guide us.
Good morning to everybody. We commemorate in World Reflexology Week 2020. It's an online international conference today, 27 September 2020. It's organized by Dr. Anil Jain. I'm thanking to him to give opportunity me to having this presentation to you. This is reflexology. Okay. When you think about the history of reflexology, it goes to the ancient time. More than 5,000 years ago, we have this treatment. Talk about the benefit of reflexology. You can treat to the many diseases like allergic, arthritis, asthma, neck problem, and etc. And also the kidney, especially I'm talking about the kidney disease. When you having the kidney disease, we can treat the kidneys. We have talked about what are the kidney reasons of kidney disease. Why people get sick to the kidney disease. And first reason is not enough water. Some people, they don't drink enough water, enough pure water. And drinking bad water is very bad. And also the hypertension. People having hypertension, then it's very bad because it gets a damage to our kidneys. Also the diabetes. People having diabetes many years, they get the bad effects to the kidneys. And also the more sex, giving the bad effects to the kidneys. These are the main reasons and to having the kidney disease. Some people, they have depression sometimes. By having a couple years sometimes, some people, they have a headache. And people then get a bad effect to your system. And your nervous system also get damaged. And also with when you get the damage to the nervous system, people get damage to their kidneys because people having depression, they may get the hypertension. When you have hypertension, it's one of the cause of for the kidney diseases. And when you have the kidney disease, in the patient urine, they get more creatine and more uric acid, and some people have itching, uneasy, swelling, and loss of kidney function. When you have the loss of kidney function, you have to go for the dialysis or kidney transplant. When you have the kidney transplant, you need a very good kidney, and you must get how to tally the kidney. That's very important too. Some people, they sell their kidneys to some people. Some people, they buy it, but it's not matched. One have not matched, what happened? Both of them get damaged. The kidney donor and the kidney transplant who also get damaged. And we could see. Then best thing is protect the kidneys. And even the kidney when you have the kidney transplant, we can have a lifetime we can take the medicine. And when we have lifetime medicine, how get the lifetime medicine? Some people, they affect, especially like this coronavirus. If we have money, there are money people, but they don't. Some people, they didn't get medicine because you can't, no transportation, nothing. If you have people like that, then better to protect your kidneys. When you protect your kidneys, you have to have very good habits like eating habit, exercise habit, everything, and have a very good mental stability too. then you don't get the kidney disease, and especially you don't get the hypertension, and you don't get the diabetes, and you don't get the kidney disease. If you have people having the diabetes and hypertension, you are leading to the kidney disease. That's why we have to protect from the people. Some people having diseases like hypertension and diabetes. We have to protect from those things. Then you don't get the kidney disease. Especially people having very good habits, and very good habit means drinking habit, and very good eating habit, and if you have a very good lifestyle, then you don't get the kidney disease. When you have any kidney disease, then you get damage the kidney. Then not enough pass in the urine properly, and with the urine get more the creatine and more uric acid, etc. Then better to have very good treatment. What is the very good treatment for kidney disease? Actually, very good treatment is acupressure. Acupressure means you can do with reflexology, through the reflexology. And there are places like head, the brain, pituitary gland, pancreas, lung, spleen, adrenal gland, and the lymph gland, and the kidney. These points are, if you having a very good pressure, you do a very good pressure, then you can get the very good result. And also you have to drink water, increasing the drinking water level. Then you have increase your treatment, and you get the very good result. And also you have to drink black tea in the morning, early morning you can drink the black tea. And also check every day morning, you can check the urine, level of the urine, and how status of urine, and the smell, and quantity, and the color of the urine. Then you can see when you having this reflux of the treatment, then you can see the day by day increasing the level of urine, and also you can see the color, very good color of urine, and also you get the taste, and you can see the smell of urine. Then you get a very good result. This treatment, if you have after 2-3 weeks, you can have you can see the very good result. And also to get the cure of the kidney disease, you can have in nearly 90 days, about 90 days treatment. When you have the 90 days treatment, you can get the cure of your kidney diseases. Then you have a very good life. But in my experience, I met one person in Serbia. I gave him the treatment, and he having the edema in the legs. He reduced his edema in the legs. But unfortunately, I had to come back. I had to come from the Serbia. Then after I didn't go to, because I had to wait come to Sri Lanka. Then I gave him about 15 years ago. I gave him one treatment to a very famous music director, and he's reducing his edema in the legs, and get the very good color in the urine, and he had a very easy life, and eating he controlled his eating, and he had very good time. Then, but unfortunately, I could not continue treatment. He had heart failure, then they are given for the putting strength, and when they have taken the strength, they have taken to some other area, and also he got the kidney transplant, one donor, he got the one donor, and not probably work, he died after a couple of months, he died. But also now, these days I am treating one person here. Now I'm giving treatment to one person here. He was a businessman, and he having a kidney disease like more than about 6 months. He taking medicine. He came to me, but when I came to me, I checked him, and after that, I advised him to take every day morning first urine sample and check that. And I give him very good treatment. He's having the edema in the legs and reducing edema, and he could eat. Now he couldn't eat. Now he can eat. He eating properly, and he said he having a very easy life now. For the body, he get a very easy life, not eating or anything. Early he had eating, and many places he could eating, and now he said he don't have that kind of problem. He expected me come to me another couple of months to get the treatment, because I am giving him the treatment without charging money. I said this is my duty to do for you. That's why. And when you do acupressure or which is especially through reflexology, you can do a very good treatment to the people, and very good result. And this kind of thing we can do because we are the human beings. We support the human society to be they are having a very good life and very good healthy life. Thank you, and I'm Cyril, Antony. I'm thanking you to you, everybody, and I'm thankful you're listening to me. Okay, thank you.
Thank you for your very helpful tips that each and every one of us can benefit from. So let's give a warm round of applause. You have made a difference. Thank you so much. So such a personality today in our first international conference is a blessing. A person who is always ready to render a helping hand to the poor and needy. An inspiration to many, and who has spent a whole life in naturopathy. Yes, I am talking about none other than our own Professor Dr. K. Satya Laxmi. She graduated in Diploma in Naturopathy from Gandhi Nature Cure Medical College in 1986, and soon after started her private practice from her clinic by the name New Hope Nature Cure Center. Ma'am is also involved in social and cultural work in the society. Currently, she is the director of the National Institute of Naturopathy, Pune, which has also started the construction of Nisarg Gram in 2019 on an area of 25 acres, a full-fledged nature cure college, yoga, a meditation hall, Gandhi Memorial, and naturopathy disciplines. She is also the editor of Nisargopchar Vartha, a monthly magazine. She is greatly influenced by the Gandhian philosophy and his role in naturopathy. Ma'am, it's a pleasure to have you here with us today. Can you please guide us? Thank you. College yoga, a meditation hall, a Gandhi Memorial, and a naturopathy disciplines. She also the editor of Nisargopchar Vartha, a monthly magazine. She is greatly influenced by Gandhian philosophy and his role in naturopathy. Ma'am, we are pleased to have you here today. It will be my pleasure to invite you to please tell a few words and guide us. Thank you.
Namaste. Greetings on World Reflexology Week. Thank you for giving me this opportunity to share my views on self-health reliance through naturopathy. Naturopathy is a system of health which talks about or tells about the importance of nature in restoring health. See, this health and disease are not two distinct, separate identities or entities. They simultaneously go and function and show their their manifestations in the body. So when there is the health process that is taking up in the body or actively working, and we enjoy the beauty of health. Similarly, when disease process is taking place, we may have certain issues like temperature rise or cold, cough or loose motions or vomitings or aches, pains, and all these kinds of some of the inconveniences which we call it as disease. So what do we do every time there is a disease? Do we rush to doctors or do we end up taking medicines? No, most of the time body on its own gets again repaired. So this is what we call human body has a remarkable recuperative power when left alone. So how this remarkable recuperative power works? Only when we allow it to work. If we don't allow it to work and constantly interfere with it, the processes of disease gets actually strengthened instead of the processes of health being activated. So I am trying to again repeat again. See, it is the process of health which gives us these small discomforts. It could be pain, headache, loose motions, lack of sleep. All these are temporary, transient changes in the body that we experience as a process of health. You get raised temperature because your body is attacking pathogens. If you stop this temperature, what happens? You are actually aiding pathogens to spread or live longer in the body. So that's when naturopaths coined it as, if you suppress acute diseases, they result in chronic diseases. Like if there is fever or loose motions and on and off these day-to-day health problems, and for every time if you are taking a pill, or like acidity, you keep on having antacids, what happens? You, over a period of time, your defense mechanism, your body in fact stopped responding or even reacting. So we end up having chronic diseases which become incurable. That means like diabetes, hypertension, all these allergic disorders are a result of suppression of acute diseases in the past. So if this is understood, whenever there is any disease process in the body or any discomfort in the body, we in fact feel happy. We should invite it. And we should feel happy that our body is reacting and responding and taking charge for itself. If we take charge from externally by giving 500 milligrams of paracetamol for temperature, irrespective of body weight and age and gender, so it will have its own effect in the long run. So we are telling, so these are the early signs of health, good health. If your body is responding, it's good to have these fevers. That's why Hippocrates, long back, he said, God give me fever, I can cure all diseases. So fever is good, vomitings is good, loose motions is good. So don't suppress it. That is the first rule that one should follow. First of all, one should not fear disease. Then there is no fear of disease. When there is no fear of disease, you are not complicating the process, and we are not suppressing it, you are not going for chronic diseases. So everybody will have these issues, accept them and treat them well and see that you quickly come out of it. But never suppress. Okay, that is the first rule. And the second rule is, use your vitality judiciously. How do you do it? See, when you unnecessarily spend your energies and keep on, it is like a bank balance. If you keep it and keep adding to it, it will increase. If you keep sucking from that, if you start taking more from it, then you get depleted. Similarly, we all are given a good amount of vitality when we are born. That is, health is guaranteed. We all have health. It is disease which is transient. It comes and then goes. But if we don't understand this and then deplete this vitality by unnecessarily adding to it or eating, like food habits. If you eat too often, even without digesting the first meal, the digestion includes elimination. So whenever you eat any food, you are expected to digest, assimilate, and the waste products are to be thrown out. That completes the digestion process. But if you start eating even before this process is completed, you are adding to the existing matter which needs to be digested. It is like cooking rice and then you are adding fresh rice to it. So neither gets properly cooked. Either some of it is overcooked and some of it is not cooked. Similarly, with regard to exercise, if you over-exercise or if you don't exercise, then also your body is taxed. Say for example, all animals, since we are part of the animal kingdom, all animals are expected to do some physical activity in order to get their food. And then, only then they can digest it. And we, because we are intelligent beings and we store and then eat. So the physical activity has come down in order to search for food. Since that is removed, now we have to bring in exercise as a physical component in our daily routine. So, but that should not make us exercise freaks, or we should not overdo it, or we should not do less. Depends on what we are eating, where we are staying, in what climatic zone and conditions we are living in. We have to judiciously do exercise. And then sleep. How much to sleep, how many hours one should sleep, and how deep the sleep should be. All these will have a say on the repair processes that are embedded in the body. And the human body is linked to sun movements. Now, sleep is very important component and in this repair process. I am particularly emphasizing this sleep in addition to food is because we are essentially nourished and all our metabolic processes are linked to sleep. And the sleep, when to sleep? Anytime? Now, because of time zones and then people working in particularly software, they are sleeping in the daytime and then working in the nights. But then that is actually showing on their health. At the age of 20-25, they are becoming cardiovascular patients. And their judgment is actually taking them wrong, and then road accidents are taking place. And all this in addition to psychological issues. Road rages and then anger and then lot of violence, all that you are seeing because of this lack of good sleep. And good sleep means quality sleep, not long hours of sleep. So this quality sleep, to ensure that there are certain things we all must follow. One is make your room dark, because in white light you cannot sleep, and because your hormones that are responsible for sleep get activated as soon as light is seen. And then mobiles and laptops and all these gadgets interfere with sleep. So keep them as far as possible and then don't touch them during certain hours, and maintain these schedules. And then before going to sleep, prepare yourself. That is, do little bit of meditation or little bit of pranayama or some kind of affirmation, some kind of, these things will ensure good sleep. You are keeping all your tensions, worries away and then going to bed. With these small steps, one can assure good sleep. So now good food, good exercise, good sleep, all these three will ensure good vitality. And in order to nurture the vitality that is already given to us, we should also engage ourselves, since we are social animals, in some kind of social activity. It could be charity in terms of money, or it could be kind of social help. Helping others will help you internally, and this is all medicine now. So that's the reason now people are incorporating this kind of activities in their jobs also. So some now through taxes, of course, we are giving some of our earnings, but then that is not sufficient, because that we are not doing consciously or willingly. We are doing because out of compulsion. But then what is charity after all? Charity is not giving away what you want to get rid of. Giving what actually is needed to you. So you should suffer on account of not having it. That is what is called charity. Can we do that? And the best thing is, go spend some time with somebody. It could be old age people or Divyang or any other category where our services are required. That will greatly boost and enhance our vitality. And with regard to exercise, many people ask in Nature Cure why it is yoga which is always advocated in Nature Cure centers. Because this is the peculiarity of Indian naturopathy. As such naturopathy, it has originated in the Europe, but when it came to India, within few years, yoga has been added to it. Because the virtues of yoga, not only the asanas, but then the pranayama, meditation and kriyas have been well integrated into Nature Cure, because in both the systems, there is no external involvement. It is the education of the person and the person's self practice, that restores health. So these two go well in bringing that kind of internal resources out to help an individual repair himself. So that is the reason we advocate yoga as not only as a physical exercise, but also for mental exercise and de-stressing, and also for cleansing. The kriyas that are taught in yoga are used as cleansing methods in repairing. So these are all for health maintenance. We are all expected to be responsible for our health, because losing health is losing everything. So you can't afford to do that. And supposing in spite of all this you fall ill, what do? It could be because of environmental reason or social reasons. You may contract disease. It could be infectious or non-infectious. Then what do? Then also in Nature Cure, there are so many therapies which are non-pharmacological. That means non-medical. No drugs given. But we use medicines. Like sun is our medicine, water is our medicine, food is our medicine, fasting is our medicine. And these days we are going much more into acupuncture, ozone, chelation. All these are incorporated into Nature Cure now in restoring health. When one has any health problem, very chronic health problems, such as even rheumatoid arthritis to cancers, all these diseases, common cold to cancer, all are treated using these therapies and massages and suggestive therapies, mind-body medicine. These are all will help a person get rid of all toxins that are accumulated. So for the disease, one should understand that disease occurs only when there is morbid matter accumulated in the body, and that vitiates the blood and all other bodily matter inside the body, and then that results in disease. So in order to bring back health, the naturopaths essentially do only one thing, that is to activate 4 eliminative organs. What are these 4 eliminative organs? One is, the first and foremost thing is large intestines. And the second one is kidneys, then lungs, and then skin. Now, they employ all these methods. It could be enema, it could be steam bath, it could be some tub bath, or fasting. The idea is to activate either of these eliminative organs or all the eliminative organs. So, by giving enema, we are not only activating the large intestines, we are also activating kidneys. By making a person do pranayama, we are not only activating lungs, but we are also activating skin. So like this, we, in a combination of these therapies and diet and yoga, we try and then cure a person. That's why in Nature Cure, you come with any disease. You not only get rid of the disease, but also you get other benefits of other organs coming into a good shape. So it is very, very easy. Most of these therapies can be practiced at home. Most of these treatments are cost effective, and anybody can practice it with or without any disease, and on oneself and also on their family members and known circles. This is exactly what Mahatma Gandhi was doing. When he was in London, he was introduced to the principles of Nature Cure. When he went to South Africa, and there he practiced Nature Cure, and not only on people around, but then first he started on himself, then he started on Kasturbaji, then on his children, and then ashramites, and then general public, so much so that he could even treat Boer War victims, he could even treat plague victims. You know, he could see the virtues of Nature Cure in addressing all maladies. And then when he came to India, then he assumed the role of not only healing the country from the Western domination, but also he started healing people using Nature Cure. It is such a simple thing. It is he who coined that Swavalambana ke liye Swasthavalambana chahiye. If you want to enjoy the freedom, you have to enjoy the freedom of health. Freedom of health comes from completely getting rid of dependence. Dependence from doctors, drugs, and hospitals. I wish that you do the same and take care of yourself and tell all your known circles to be healthy by minding these principles, which are so simple, easy to understand and experience and practice. Thank you so much once again. Congratulations to all those who are participating in this international conference on Reflexology Week. Thank you.
Thank you for your very helpful tips that each and every one of us can benefit from. So let's give a warm round of applause. You have made a difference. Thank you so much.
I'm president of the International Council of Reflexologists, and I'm also a teacher and a passionate reflexologist, just like you. I'd like to thank International Reflexology Jain Academy for inviting me here today, and I hope you enjoy the presentation. The subject today is the location of the reflexes of the vertebral column on the body reflected in the feet and how to work them. So let's just get to it, and I'll share with you now the presentation. I want to first acknowledge my mentor, Dr. Martine Alderson, who wrote a few books. The one concerning foot reflexology is called Total Reflexology, the reflex points for physical, emotional, and psychological healing. Dr. Alderson was a homeopath, acupuncturist, naturopath, medical herbalist, reflexologist, pioneer. She was much loved, and her background was as an osteopathic physician as well. She brought a scientific precision to using the foot as a map of the body and all its systems. Let's have a little review now on the vertebral column and its reflexes on the foot. In headlines, in big lines, we have 7 cervical vertebrae, 12 thoracic vertebrae, 5 lumbar vertebrae, and the sacrum and coccyx. Here it is reflected on the foot. If you look at the area that we refer to generally as the neck, which is the first phalanx of toe 1, then the 7 cervical vertebrae are there. They go slightly down into the back, posterior, where C7 meets up with T1. We have our 12th thoracic reflected on the foot, generally speaking, in this area. We have the 5 lumbar. Notice they are larger. They take up a little more space, and then we move into the sacrum and coccyx. Let's have a look now at the peripheral nerves, which of course communicate with our organs and glands and other body parts. So the central nervous system consists of the brain and the spinal cord. The spinal cord is inside the bony vertebrae. So that's the central nervous system, which controls in general the whole body. The peripheral nerves involve the 12 pairs of cranial nerves, as well as the nerves which emanate from between the vertebrae. And they connect to, as you can see here, these are the cranial nerve connections, mostly to do with the head, as far as your vision, your sense of smell, your mouth, the salivary glands, etc. And then as we move down, the peripheral nerves connect to the heart, the lungs, all the other organs and glands. Note that it is important to keep the nerves unimpeded so that the body can function properly. Here's just another view of the brain, spinal cord, and the peripheral nerve connections. What I want to point out here is that you have a ganglionic chain connected to the nerves which emanate from the vertebrae. And in this chain, it's a grouping of nerves. It's on both sides, even though it's shown on one here. And in this ganglionic chain, this is related to the sympathetic fight or flight nervous system. The chain ends on both sides of the spine underneath the coccyx at the very bottom where they join together. Now we'll just do a review of the peripheral nerves related to the area of each vertebrae. If we look at cervical 1 atlas, it provides, the nerve connections there provide blood supply to the head, pituitary gland, scalp, bones of the face, to the brain in general, the ear, the sympathetic nervous system is what it's related to. Possible symptoms in people could be headaches, nervousness, insomnia, head colds, high blood pressure, migraine, headaches, amnesia, chronic tiredness, dizziness. And now we go to cervical 2 axis vertebrae, and the area and parts of the body involved in that nerve connection are eyes, optic nerves, auditory nerves, sinuses, mastoid bones, tongue, forehead, You see reflected here on the right part of the screen, perhaps it's on the left for you, the whole face area is lit up. So the possible symptoms for people could be sinus trouble, allergies, earache, fainting spells, certain cases of blindness, crossed eyes, deafness. Cervical 3, you see shown here on the neck area and reflected here in the face. This involves cheeks, outer ear, face, bones, teeth. Possible symptoms: neuralgia, neuritis, acne, pimples, eczema, all that fun stuff. Cervical 4, the areas affected are nose, lips, mouth, eustachian tube. We see here most of the jaw area. Possible symptoms: hay fever, runny nose, hearing loss, adenoids. Cervical 5, areas involved are vocal cords, neck glands, pharynx. Possible symptoms: laryngitis, hoarseness, throat conditions such as sore throat. Cervical 6, neck muscles, shoulders, tonsils. Possible symptoms: neck pain, pain in the upper arm, tonsillitis, chronic cough, and croup in babies. We see the area, all this area reflected here in the neck, lower neck, and shoulder. In cervical 7, affects thyroid gland, bursae in the shoulder, the elbows. Possible symptoms in a client: bursitis, colds, thyroid conditions. Thoracic 1, arms from the elbows down, including hands, wrists, fingers, esophagus, and trachea. So this is T1. Possible symptoms: asthma, cough, difficulty breathing, shortness of breath, pain in the lower arms and hands. Thoracic 2 involves the area of the heart, including its valves and covering, and coronary arteries. Possible symptoms: functional heart conditions and certain chest conditions. Thoracic 3, lungs, bronchial tubes, pleura, chest, breast. Possible symptoms: bronchitis, pleurisy, pneumonia, congestion, and flu. Thoracic 4, gallbladder, common bile duct. Possible symptoms: gallbladder conditions, jaundice, shingles. Thoracic 5 involves the area of the liver, solar plexus, circulation in general. Conditions: liver conditions, fevers, blood pressure, poor circulation, arthritis. Thoracic 6 involves the stomach area. Possible symptoms: stomach troubles, including nervous stomach, indigestion, heartburn, dyspepsia. Areas involved in thoracic 7 are the pancreas and duodenum. Possible symptoms are ulcers and gastritis. You can see on the model here that it's the upper area. Areas and parts of the body relating to thoracic 8 are mostly the spleen. Possible symptoms: ulcers, gastritis, lowered resistance. Thoracic 9 involves the adrenal and supraadrenal glands, supraadrenal, and possible symptoms: allergies, hives. Thoracic 10 involves the kidneys, so possible symptoms: kidney troubles, hardening of the arteries, chronic tiredness, nephritis. Areas of thoracic 11 are kidneys and ureters. Possible symptoms: skin conditions such as acne, pimples, eczema, boils. Thoracic 12 involves the small intestine, the lymph circulation. Possible symptoms are rheumatism, gas pains, certain types of sterility. Lumbar 1 involves the large intestines and its inguinal rings. Possible symptoms: constipation, colitis, diarrhea, hernias. Lumbar 2, areas affected: appendix, abdomen, upper leg. Possible symptoms: cramps, difficulty breathing, varicose veins. Lumbar 3 involves sex organs, the uterus, the bladder, the knees. Possible symptoms: bladder troubles. Lumbar 4 involves the prostate glands, the muscles of the low back, sciatic nerve issues. Symptoms: sciatica, lumbago, difficult, painful, or too frequent urination, and backaches. Lumbar 5 involves the lower legs, the ankles, the feet. Possible symptoms: poor circulation in legs, swollen ankles, weak ankles and arches, cold feet, weakness in the legs, and leg cramps. In the sacral area, which is that triangular bone of the lower back hip area, it involves the hips, hip bones, buttocks. Possible symptoms: sacroiliac conditions, spinal curvatures. In the area of the coccyx, this area touches on the rectum and anus. Possible symptoms: hemorrhoids, itching, pain at the end of the spine on sitting. So we can see why working the vertebrae, the bony vertebrae reflected on the feet is very important, because we want to free up the nerves that go between these vertebrae and innervate the related organs and areas all around the body and in front of the body. Here we have, this is from Dr. Alderson's book, Total Reflexology of the Feet. And you see here the bones, a medial view, as well as a lateral view on the bottom of the bones of the feet. So the big toe here, toe 1, zone 1, you see the first phalanx, and this is where we have 7 cervical vertebrae. I'll explain in a minute in more detail. In the long bone of the first metatarsal, you have your 12 thoracic vertebrae in this long bone. And then if you note, there are spaces between these bones, medially, dorsally, plantarly. You need to be able to find the spaces so you can delineate where does the next bone start. And sometimes it's hard if your client has thick tissue in that area. Sometimes it's not easy. So I suggest when you explore with your fingers where are these spaces in the foot, that you move a little dorsally and on the plantar as well, because sometimes it's more evident on one aspect than another. Now we go to the tarsal bones. There are 7, and the first one we see here, medially, is the first cuneiform. There are 2 vertebrae points and areas reflected here. We'll see it in a minute. The scaphoid bone has, before I should have said lumbar 1 and now we move to the scaphoid bone where we have lumbar 3. And then we have the fairly large talus bone, which supports the weight of the tibia. And on the other side, of course, on the lateral foot, on the fibula. So on this talus bone, we have 2 vertebral regions. The first one here is L4. And just underneath this tibia, underneath it, and you have the talus, and underneath the talus, you will find a spot for L5, which is quite an important point since many people support either weight from the upper body and or weight of the world. And so L5 is often affected. And moving into now the calcaneus, the heel bone, we have actually our 5 sacral connections here and the coccyx point, which is major as well. We don't really focus right now, on the lateral points, but I just want to point out that there is an opening over the heel bone where it meets up with the talus. In this whole area here, there's also a reflection of the outer sacroiliac joint, whereas here on the medial edge, it's the inner sacroiliac joint. I just want you to start getting used to visualizing as you're working on someone, where exactly am I inside the actual macro body. This is also from Dr. Martine Four-Alderson's book, Total Reflexology, and here we see the exact locations of the spinal vertebrae. If you look at the first phalanx of the big toe, this is a medial view. The phalanx has a distal head, meaning a thicker part as we approach the edge of the toe, the end of the toe, and a proximal head, meaning a thicker part, just before that. So on the long bones here, so the 7 cervical, we're going to locate them here. Cervical 1 and 2 is on the distal head of the phalanx of toe 1. Toe 1, phalanx 1. And then if we look at the proximal head of this phalanx, we have a couple of points as well, which are 6 and 7. And the other points are in between. Locate the space between these bones, and then if we go to the long bone on the distal head here, where the bone is thickest, we have 4 points for thoracic vertebrae, being T1, T2, T3, T4. We continue on down. T9 is approximately in the middle, but a little further toward the heel. So T9 has a role to play with the diaphragm. And T11, T12 are on the proximal head of this long bone, the first metatarsal bone. Find the space between this bone and this bone. We now are at the first cuneiform, the first tarsal bone medially. And there are 2 vertebral connections on this bone, L1 and L2. So if you work just generally this area, and intuitively, you may feel, I'm right on the point here. But it's a whole area regardless. Find the space to the next bone, which is the scaphoid. And here we have lumbar 3 vertebrae. And then we move on to the talus bone. There's a very tight space here between these 2 bones, so you'll have to palpate a lot to find it. Here we have L4, lumbar 4, on the talus bone. And lumbar 5 is just underneath, or is kind of on the edge of the talus bone, just underneath, which sits under the tibia. And it's, if you go to the middle of the tibia and make a line down and just hit underneath the talus bone, you will touch on L5. Notice that the line here continues to right into the sacral bones. The sacral bone, which has 5 reflex points here and 5 sacral connections, S1, S2, S3, S4, S5. And just underneath that, at the turning of the inside of the heel bone, you can really feel where the coccyx area is. This is the coccyx. I would like to point out the yellow drawing here, posterior to the foot and above the heel. This represents the Achilles tendon. And for us, this whole area, if you work close to the bone and just above the bone here, this is the sacroiliac area. So it's where the sacrum and the hip bone, the ilium, are come together and also meet with the area where the sciatic nerve has an insertion. So for this whole area is fantastic for sciatic nerve work. Sorry, went too fast there. So now is simply thank you for watching this presentation, and now I'm going to show you on a skeletal foot precisely where these points are. So I'm going to stop sharing. Skeletal foot. So this is the big toe here, and of course normal feet don't do this. Mine do. So this is phalanx 1 and 2, and on the first phalanx you have your 7 cervical vertebrae. So C1 and 2 are on the distal head. The bone is thicker here. I don't know if you are able to see that. You count down 1, 2, and then 3, 4, 5, 6, 7 are on the proximal head. There's thick bone here on this first phalanx. Find the space between these 2 bones, the first phalanx and the long bone of the metatarsal zone 1, metatarsal 1. On the metatarsal head, which is also quite thick, you've got T1, 2, 3, 4. And then you count down 5, 6, 7, 8. T9 has a tiny little groove in it quite often. T9 is related to the relay to the diaphragm as well. So it's a good point to linger on, work a little extra. Then you have 10, 11, and 12 are on the proximal head of this long bone of metatarsal 1. Find the space when you're working on someone or on your own feet. Palpate around dorsal, medial, plantar, and you'll find the first round bone of the tarsals called the cuneiform. And here we have lumbar 1 and lumbar 2. Excuse me, yes, that's correct. And then we find the space to the next bone, which is the scaphoid, and you'll find lumbar 3 area. Work the whole area. Press on a point when you think it's there, and work the whole area. Press on the point for lumbar 3. Moving on between lumbar 3 and talus. So lumbar 3 and talus. Talus has lumbar 4 point. It's right at the beginning of the talus, about ½ an inch in on this foot. And then you move to lumbar 5, which is below the tibia, yes, but it's also below and diagonal here on the talus bone. Just to show you that it's in the midline here, but on talus bone. And then you keep walking. There is a groove here. You may find it. I call it the shelf of the heel bone, calcaneus. So keep walking to the sacral points here, the sacrum. S1, you know, I just want to point out the sacrum is on the inside of the heel bone. There's like a groove in there. You know you're in it because it's deeper. So S1, 2, 3, 4, 5, and coccyx is the whole corner here of the heel bone. So that's these points located on the bony foot. And now we'll just look at this foot. And if I were to work it, you can start either from the top as you normally work your spine, or from the coccyx here. If I were to start from coccyx, and I'm doing it with my index, I normally work with my thumbs, but just for demo purposes, coccyx, moving into sacrum 5, 4, 3, 2, 1. I like working, when I'm working vertebrae, and Dr. Alderson recommends this as well, that you go in little circles over the whole spiny foot, bony foot, I should have said. And as you're walking up with circles with your thumb, so if I were going downward, I would walk this way and really focus on each of the 7 cervicals here. Find the gap, locate the first long bone, metatarsal, and focus on the first 4 points which are close together. Walking down this long bone to the proximal head, find the gap, moving into lumbar 1 and 2. Here on the cuneiform, continuing to work on lumbar 3, lumbar 4, and lumbar 5 underneath the talus bone. 4 and 5 are here. Also, as you're working along, go into the bony shelf right to the edge of the heel bone, and then come back a bit into the groove so you can walk into the sacrum coccyx area. Remember too that this whole Achilles tendon area works low back, rectum, sciatic. So really, when you work it, do not pinch this area, very tender. I use the compression of the palm of my hand when I work on Achilles tendon. I make it nice and juicy and slide down. And you're working there, low back, rectum, sciatic. Another tip, when you're working on this spiny, bony foot, you can work diagonal and plantar going in one way, and then for the return, you work really medial, and your little circles will touch also on the dorsal. To be sure to get that whole bony vertebrae area, because remember that the actual bony spine has vertebrae on the left side and on the right side. So you want to cover each aspect of the vertebrae. Remember as well that the bony vertebrae has an inside part inside our body. So when you're working, try to put your intention on that whole structure and you'll get really good results. Thank you for being with me today, and I wish you a very happy World Reflexology Week. And see you next year. Bye-bye.
Thank you for your very helpful tips that each and every one of us can benefit from. So let's give a warm round of applause